Urine testing is frequently performed in the medical office. The advantage of urine testing is that urine is readily available and does not require an invasive procedure. The type of test to be performed often dictates the method used to collect the urine specimen. A clean catch midstream specimen is recommended for identification of the presence of a urinary tract infection. The urinary tract is made up of the kidneys, ureters, urinary bladder, and urethra. The kidneys, ureters, urinary bladder, and most of the urethra are normally sterile and free of microorganisms. However, the distal urethra and urinary meatus normally harbor microorganisms known as normal flora. To culture and examine a urine specimen for bacteria, a clean catch midstream specimen is necessary to prevent contamination of the specimen with normal flora. Only the microorganisms that may be causing the patient's condition are desired in the urine specimen. The medical assistant will show you how to instruct a patient in the collection of a clean catch midstream specimen. It is important to provide complete instructions for the collection of the specimen. Failure to instruct the patient adequately may mean the patient has to return to the medical office to collect another specimen because of contamination of the specimen with normal flora. Begin the procedure by sanitizing your hands. Greet the patient and introduce yourself. Identify the patient and explain the procedure. Assemble the equipment. You will need the Clean Catch Specimen Kit, which includes a sterile specimen container with a lid, a label, and 3 antiseptic towelettes. Label the specimen container with the patient's name, the date and time, the type of specimen, and your initials. The medical assistant will first instruct a female patient how to collect a clean catch specimen. Wash your hands. Open the package of antiseptic towelettes and place them on the wrapper. The towelettes are saturated with benzalkonium chloride, an antiseptic that is non-irritating to the skin. Remove the lid from the specimen container and place it on a paper towel with the opening of the lid facing upward. Do not touch the inside of the lid or the inside of the container because these areas are sterile. Pull down your undergarments and sit on the toilet. Expose the urinary meatus by spreading your labia apart with one hand. Next, cleanse one side of the meatus with an antiseptic towelette using a front-to-back motion. Discard the towelette in the toilet. Now cleanse the other side of the meatus with a second towelette using a front-to-back motion, and discard the towelette. Using a front-to-back motion, cleanse directly across the meatus with a third antiseptic towelette. Discard the towelette in the toilet. The purpose of cleansing is to remove the normal flora from the urinary meatus. A front-to-back motion must be used for cleansing to avoid drawing microorganisms from the anal region into the area that is being cleansed. Continue to hold the labia apart and void a small amount of urine into the toilet. This flushes the normal flora out of the distal urethra. Collect the next amount of urine by voiding into the sterile container. Do not touch the inside of the container as this will contaminate it. Fill the specimen container about half full with urine. Void the last amount of urine into the toilet. This means that the first and last portion of the urine flow is not included in the specimen. Replace the lid on the specimen container, making sure not to touch the inside of the lid. Wipe the area dry with a tissue and discard it in the toilet. Flush the toilet and wash your hands. Now the medical assistant will instruct a male patient how to collect a clean catch specimen. Wash your hands. Open the towelettes and remove the lid from the specimen container. Pull down your undergarments and stand in front of the toilet. Retract the foreskin of the penis if you are uncircumcised. Cleanse the area around the meatus and the urethral opening or urinary orifice. This is done by cleansing each side of the meatus with a separate antiseptic towelette. Discard each towelette in the toilet after use. Cleanse directly across the meatus with a third antiseptic towelette and then discard the towelette. Void a small amount of urine into the toilet. Collect the next amount of urine by voiding into the sterile container without touching the inside of the container. Fill the specimen container about half full with urine. Void the last amount of urine into the toilet and replace the lid on the specimen container. Wipe the area dry with a tissue and discard it in the toilet. Flush the toilet and wash your hands. Provide the patient with instructions about what to do with the specimen after it has been collected. The specimen may be placed in a designated area or handed directly to the medical assistant. In this office, the specimen is handed to the medical assistant. Chart the procedure. Include the date and time and the type of specimen collected. Also record the date the specimen was transported to the outside laboratory. The urine specimen is being sent to an outside laboratory for culture and sensitivity. You must complete a laboratory request form to accompany the urine specimen. Place the urine specimen and the request form in a biohazard specimen bag. Preserve the specimen by placing it in the refrigerator for pickup by a lab courier.